views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening and welcome to BronxTalk. COVID-19, more commonly known as the coronavirus, has been launched to the top of the worldwide priority list in record time. This epidemic seems to be approaching pandemic proportions, and with news about testing kit shortages and lack of supplies, not to mention empty shelves with no hand sanitizer, health officials are scrambling. Also, the economy is taking a hit. As a result of all of this, we're going to get you as much information as we can this evening. In a moment, we'll be joined by Professor Falguni Sen, who is the director of the Global Healthcare Innovation Management Center and also the director of the MS Program in Health Administration at Fordham. But right now, please join me in welcoming on the phone the Chief Medical Officer of Union Community Health Center, Dr. Jae Ahn. Dr. Ahn, thank you for joining us.
It's a pleasure.
And we were just talking just before the show. Health officials are scrambling right now. This is a lot of pressure with a very serious issue, isn't it?
Yes, we want kind of a measured response where we don't want to promote panic, but we want concern and people to be aware and to protect themselves and take precautions without people hoarding. Going to the store or buying masks, such.
Well, let's talk specifically about those precautions. I think Bronx people, many of them are healthy and well and moving around, but there is a lot of fear, and they see what's on the news, and they say it's extremely contagious, and they don't know who can I talk to? Can I ride the subway? Can I ride the bus? So from your perspective and the folks at Union Community Health Center, what do you recommend?
We generally recommend universal precautions, which means mainly wash your hands often with soap and water for at least 20 seconds. If water is not available, use an alcohol-based hand sanitizer. And then if you are sick, please cover your cough with tissue or your sleeve or something and not basically have droplets aerosolize into the air. And also, don't touch your face, specifically your eyes, nose, and mouth, because this is the port of entry for all upper respiratory infections, including not just the COVID-19, but for the flu virus as well. We also recommend that you should get the flu vaccine, just because it will not protect from the coronavirus, but it will prevent you from the currently circulating flu, which has similar symptoms. So if you can prevent the flu, maybe less patients will get sick and we'll have less people going to the health centers and the emergency departments and picking up resources, because right now there's limited resources, including some shortages of some of the testing kits.
Is COVID-19 basically more contagious than others? Seems to me one of the issues here, aside from the fact that there doesn't appear to be a cure and testing kit issues and all that kind of stuff, is that it appears to be extremely contagious. So, I mean, stories that I've read and things that I've seen in the news say that if you're holding the pole in the subway and somebody's been infected, that virus, that microscopic virus, lives and you wouldn't know it, but you've somehow it's attached itself to you, and then, as you said, you touch your eye or your mouth or something, and all of a sudden you're infected. Is it more contagious than, let's say, the normal flu?
Well, this is the thing. It's a new virus, so the way it behaves, we don't know exactly. So we're very concerned about it. Now, the mortality rate is higher than the regular flu, but it's still considerably lower than the MERS and the other SARS virus. So it is contagious, but I wouldn't necessarily say specifically. It's very hard for most physicians or even epidemiologists to say how and specific because it's happening right now. So the data is not all back. So it's a measured response. You're going to have people saying that they really don't know yet. So, but it seems to be very contagious. But I wouldn't say it's a respiratory virus. So we have to be concerned about the mechanism of how it's spread, which is from droplets. So you're right, though. The point of what you made, I'm sorry to interrupt you, but
sure, go ahead.
It can live on surfaces. That's why I think they are cleaning the subways and the mass transit, and I do recommend that to frequently wipe down surfaces. You don't have to do it like every 5 minutes, but I would definitely say wipe down the surface because they don't know how long the virus lives on an inanimate object. So say you cough on something or you touch the phone and you didn't get to wash your hands because it just kind of happened all of a sudden. It can live there. They're not sure how long it's going to live there. It's not indefinite, but definitely it will be there. It could be, it could be hours to days. No one knows yet because it's the epidemic is unfolding around us. So all the clinicians are going to give measured response.
How unusual is this? In my lifetime, I barely remember anything of this magnitude that literally is sweeping across the world, and ultimately it came into the United States. This seems to me to be a very unusual situation. And then, of course, we could talk about level of preparedness. I know that Professor Sen is going to talk about that. But this is an extraordinary moment in the history of world health, is it not?
Yes, it is. And I also think it's the time that we live in, that social media and information is so readily available instantly from one place to another. So it seems like kind of so fast, but I just think it's the times that we live in.
And in terms of who really should be most concerned, it seems to me everybody should be concerned because, as I understand, even though children may not be as subject to getting the disease, but they can be carriers. So if they, again, I'll use the subway pole. They hold the subway pole, or they pick up a telephone, and then somebody takes it, and that person is a senior citizen or somebody with compromised immunity. Now all of a sudden we've got a problem. So really, everybody has to be concerned about these things. Do I have that right?
Yes, you do. We're lucky that it doesn't seem to affect the children as severely, but they can have very mild or very even asymptomatic coronavirus where they don't feel sick, but they are actually shedding the virus and transmitting it to their grandparents or somebody else in the community.
Let's just
they went to school.
Yeah, let's just wrap this up. I know that you have a webinar that you've got to get to, and health officials are really in demand, and we really appreciate your time this evening. Bottom line, don't panic, but be diligent. Do I have that right? Wash your hands every time you take the subway, every time you shake somebody's hand, every time you use, let's say, a phone in an office that might have been used by other people. All those kinds of things. Keep washing your hands, keep yourself clean. If you are responsible for facilities, disinfect those facilities. I know the MTA has been spending time and money and effort in cleaning, turnstiles and all that. Is that really the bottom line message here?
Yeah, and then also I would say if you are sick, I would also try to call in your doctor's office or health center because they're going to be able to triage you, to direct you to self-quarantine, and somebody from the Department of Health may be able to come and test you so you don't actually go out in the community and infect a group of people.
I guess This,
That's sick. There is a way that we could coordinate care where you get tested, but you don't put other people at risk because you took the subway to get to the clinic when you're not that sick.
That's right.
You're actually potentially infect a whole bunch of people that we have to track.
Right.
So, and also the transportation, the Department of Health will work with the providers to provide safe transportation of somebody that is very sick.
That's very good to know.
Yes. So,
Dr. Ahn, we really got to go, and I know
Yeah.
you do too. Chief Medical Officer of Union Community Health Center. The fact that you came on with us in this very busy time says a lot about you, says a lot about Union Community Health and what you think about the Bronx. We sincerely appreciate your time this evening. Let's all stay clean and disinfected and safe.
yes. Thanks again.
Thank
Gary.
you so much. All right, we will talk now to Professor Falguni Sen. We have so many credits for you, the head of the Fordham University Global Health Management Information Center. You run the MS Health Administration program. You work in the business department at Fordham University. Thank you for joining us.
Thank you, Gary, for inviting me.
How much cause for panic is this? I mean, this is, people look at the news. We just talked to the doctor who said, you know, if you are sensible and you're diligent about how you keep yourself clean, you could be okay, but it's very contagious. What are your thoughts?
So, you know, Gary, panic is a double-edged sword. We shouldn't panic, and I think it's good not to panic and not to make a run on the stores for supplies that don't really matter at the moment for us, and we're just creating a situation.
The face masks, they say, don't do much.
The face masks don't really do much unless you're infected or working with infected people, and that you have to have special face masks that really fit you. So it's a very good idea not to panic so that you can keep on with your everyday life. But panic does some good things as well. The WHO has determined...
It's the World Health Organization.
The World Health Organization has determined that globally we are totally unprepared for this pandemic. As a world, not just the United States, Europe as well. China obviously was totally unprepared till they really got on the act. Few countries like Taiwan have done a very good job, and we should probably learn from them. What's happened with the panic is that we have got our act together. We are trying to get our act together.
So on that level, it pushed us forward.
That's exactly right, Gary. It absolutely pushed us forward, and I think that's been a wonderful thing.
It's hindsight, I guess, but what should we have done, or what would have been a good preparedness or a logical preparedness? Of course, you can't always prepare for everything, but what could we have done without knowing that this was going to happen?
So as you know, this is actually a coronavirus very much like the SARS virus. The virus is called SARS-CoV-2, which is a variation of the SARS virus. We have known of the existence of this kind of a virus and the fact that it mutates for a very long time. We could have possibly put in much more research money into trying to work on vaccines and cure. When I say that the panic has worked, we've gotten our act together. Gilead Sciences has just started some clinical trials on their cures that worked with Ebola, and they are trying it out on the coronavirus, or the disease as it's known as COVID-19. I think if the world were prepared, there would have been a better system to share information. There would have been a better system to share actually the viruses so that people all over the world could start working on vaccines and cures.
I'd heard, I've been seeing all the news about the shortage of test kits.
Yes.
I'd heard that the Germans have created a test kit. It's being used in France and Italy, but it's taking its time to get here. That's the kind of thing you're talking about. If they have one, there's no reason why, for people's health, certainly in the democratic nations, there's no reason why we can't share that.
And that's exactly correct. The point is, we have a very robust FDA system, and they need to regulate and approve things. But if we had already looked at these kinds of kits before and gone through some pre-approval stages, we would have been able to introduce the kits into our country much quicker. Right now, we do have a shortage. And the fact that the initial CDC kits had some errors in it really didn't help.
I know that you're not specifically a scientist, but how far away do you think we are from actually having a vaccine that can cure it or at least squelch the contagious aspect of it?
As the head of NIH, as Dr. Anthony Fauci said in a recent meeting, at least a year and a half.
At least a year and a half.
At least a year
So
and a
at
half.
this point, what we need to do is extreme testing and have people really understand how to prevent with some of the things that Dr. Ahn told us about washing and disinfecting and all those kinds of things. That's a very significant thing because that affects people's behaviors and all those kinds of things. Let's talk a little bit about business. There's a lot of concern that prices have already been gouged. I mean, if you go on like Amazon and look for a little bottle of Purell sanitizer, it could cost you $50,
Right.
which is insane. How concerned are you that
May I use the word that it is obscene? That kind of price.
Any word you want, as long as it's clean, I guess.
I mean, I just do not understand how we try to, make quick profits out of miseries of people and out of false information, which is why I think what you're doing here in BronxTalk is so good and so important. It's important for people to really know what the story is. Yes, Purell is going out of stock. People are raiding the shelves. Prices are going up. Individual players are charging whatever they can. Amazon, I think, still has on its books a $47 Purell item. A good amount of plain rubbing alcohol is very good. The alcohol level should be good. And, there are lots of ways in which you can protect yourself. It's good to wash your hands, absolutely.
So maybe that's a good thing to come out of this.
Those kinds of precautions that have been suggested are all excellent. I'm not so much convinced about self-quarantine. I'm not sure how many of us really need to be self-quarantined. But there are some of us who do need to be quarantined, and we should have a system whereby we can be told, now you with these symptoms, you have to be quarantined.
I know that Mayor de Blasio talked about people who travel from China, Iran, Italy, South Korea, and Japan.
Yes.
The mayor said, you know what, please self-quarantine for 2 weeks so you can find out if you have symptoms or not. Let's talk about the stock market and the economy. The airline industry is crippled. I mean, the thought of taking, if I didn't have to take a flight right now to sit in a closed chamber with other people, I mean, I don't know. I feel like I'd have to be washing my hands all the time. But they're canceling flights left and right. Clearly, the stock market is hurting. How bad is this going to get? Can you give us some perspective on where this is at? I mean, then we talk about health organizations, health insurance, the whole domino effect.
So the airline industry is predicting a drop in revenue by anywhere between $63 billion to $113 billion. It's
over what period of time?
Over a year.
Over a year.
Yeah. The stock prices have dropped at a rate 5 times that what happened during the SARS epidemic or pandemic. So we can see that this is a much worse situation for the airline industry and for travel and tourism in general.
Especially because of the nature of what this is. You could be on a plane trapped, in essence, with other people.
Or at least the fear is a legitimate fear.
Yeah.
That you do not know where individuals are coming from who are on the same cruise ship or on the same flight as you are in. Mm-hmm. And that can be a major problem. And so it's the fear that's driving people not to postpone their travel. Companies are doing that as well. Corporations have slowed down and stopped travel.
Business travel.
Business travel. There are companies where the CEO is individually looking at what kinds of, even in CNN, I'm told, that the CEO has to look at and see who is going to actually go on a foreign travel. Who needs to go.
And then that starts a domino effect because, the commerce and everything else that goes on helps to build our economy, helps people's personal economies. But if they can't really move around, as I said, there is that domino effect. I guess I'm asking you to prognosticate. Yes. How bad does it get? I mean, sitting here, for me, that makes me panic, to be honest. I mean, that makes me say, wow, economy, how far down will it go? Can we find other ways of doing business? I don't know.
So the predictions seem to be that global GDP growth rate is going to go down to 1.6, which is much, much lower than what was anticipated. The US GDP growth rate is expected to go down as well. We live in such a connected world, especially all the manufactured goods that we purchase. The world participates in whatever we buy. And when we talk about manufactured goods and we talk about the world, we're talking China a lot of the times. There isn't a product that we buy, well, that's an exaggeration. There are products that we buy. There are many products that don't have Chinese components.
Fair enough.
If you can allow my hyperbole for a minute, the contribution of China to our manufactured goods is huge. Now China has tried to contain it within one particular region. And there are some supplies that are going to be affected by the lowering of supply, lowering of production in those items. And in that sense, we are going to see an increase in both prices as well as in availability.
Or a decrease in availability.
Decrease in availability and an increase in prices. We are definitely likely to see that, and that's going to have an impact on us.
We have a volatile health insurance industry, and
Yes.
everybody's trying to get their arms around it. Nobody's really been able to do that. There are going to be, hopefully, vaccines, test kits, and all these other kinds of things. Are there considerations in people's health plans for the testing of coronavirus right now? Are these new riders that are going to have to be written in? And then, of course, I guess, subject to price gouging again. You know, people will be desperate, potentially.
So to the best of our knowledge, Governor Cuomo recently for New York State has clearly indicated that all health insurance plans which are regulated by the state have to provide testing without any co-pays or co-insurance.
Well, that's a good start.
That does not include self-funded employer plans, but includes all other large plans. Other states are likely to follow as well, and there is definitely an indication that Washington State is doing so. And California, I know that Kaiser Permanente has been pushing the fact that there should not be any cost to an individual.
And what about travel, internal travel in the United States? I mean, I'm just kind of thinking out loud about all these possibilities, and you know, the more you're talking, I'm saying, well, that could be affected. Interstate commerce gets affected. It's hard to say.
So we haven't heard much.
Let me just interject a real situation. Would you travel to Seattle right now, where there appears to be a center of the epidemic in the West Coast? Unless I had to, I probably wouldn't.
If I'm going to, I believe, Kings County, where really the epidemic has been concentrated, and where if you look at the streets, the IT sector, which used to be bustling on the roads, are virtually empty. People are doing a lot of teleworking, and that has become the norm. And thank God, we are we are far ahead of what we were a few years back.
The infrastructure for that.
The infrastructure for that exists. Would I go? I would be careful. I'm a bit of a high risk taker. I might actually go, depending upon the work and the importance of the work that I had out there. But I would be careful.
One of the dialogues that you and I had prior to this program was how will it affect life in general, and we've just touched on that in terms of what people's behavior. You characterized yourself one way, other people may not characterize themselves that way. How in the long run, I mean, we can talk about the particulars of the healthcare industry, the travel industry, of the economy, but in terms of people's behaviors, can we correct behaviors so people are cleaner, that they wash their hands more? I mean, how will it affect life? Will people really be more cautious about taking that extra trip? I'll jump on a plane and I'll go somewhere, or, you know, that kind of thing?
So there was a recent study which said there are 17 factors that make some of us more panic-oriented and others less panic-oriented. It's very difficult to determine. The same type of information can make some people act in one way and others in other ways. We have to work on whatever is our level of comfortability and our own family situations and our risk-taking situations that we have as individuals. But I'll say something. We need to be prepared for the fact that this virus will grow. We need to be prepared for the fact that schools might close. We need to be prepared for the fact that if we can get more technology savvy in terms of if we have computers at home, to learn a few of the tricks of computers, how to use our webcam, because maybe a course you're taking somewhere is not going to be delivered on site.
In a classroom.
In a classroom, and is going to be delivered online so that we are ready for it. These are the kinds of things we've got to be prepared for.
And I want to interject, we're almost out of time. I want to interject about senior citizen centers. We know that the one in California has had, it was California, though, that was the one in Washington State, that had issues. I guess there will have to be a new look at how that's dealt with, because seniors seem to be the most vulnerable of all.
And they absolutely are. Anyone with any kind of immune deficiency or pre-existing respiratory condition is very, very vulnerable, and definitely the senior citizens are very vulnerable. Whatever we can do to prioritize testing and limit some visitations or test visitors before they come into these places and really have the healthcare workers properly tested and protected is very important.
And that goes into the whole notion of test kits and all that kind of things. I will tell you what this also for me has underscored, which has been de-emphasized, frankly, in our federal government, is the importance of science.
Yes.
Is that you can't just say, well, okay, we don't necessarily need this or need that, but we have the science. You know, maybe that'll be our conclusion. Let's put it to use and put it to our best use. You like that idea?
Let's start believing more in science than in stories.
Listen, Professor Falguni Sen, thank you so much for joining us. Continued great work, and hopefully next time we have you back, it's because we've cured the problem and you can say how we did it. Would that work?
Thank you very much. That's a very optimistic and a welcome scenario.
There we go. Thank you so much.
Thank you.
Folks, a very important show tonight, and if you have further questions or comments or anything you heard on tonight's show or anything going on in the Bronx, you can email them to us at bronxtalk@bronxnet.org. You can send us a tweet at BronxTalk, post them on our Facebook page. And I will tell you, if you get to us to ask us about a medical question or who should I call, we will respond, because we want to make sure you get care. If you have questions, please call your physician, get help. Don't go about it alone or ask your neighbor, because they may not really know, you know? It's very important stuff, and it affects all of us, your family, your friends, the Bronx, right? That's our world. We thank our producer, Helen Greenberg, our director, Richard Diaz. We also thank our friends over at Union Community Health Center. And we thank Fordham University and the professor. We'll see you next week. Good night.